Welcome to our video on Crimean-Congo Hemorrhagic Fever, or CCHF. In this video, we'll cover essential information about CCHF, including its symptoms, transmission, treatment, and prevention. Let's dive in. CCHF is a zoonotic viral disease transmitted by ticks, characterized by fever and bleeding. First identified in Soviet soldiers in Crimea in 1944, it was later linked to a virus isolated from a child in the Congo, leading to its current name, Crimean-Congo Hemorrhagic Fever. CCHF is an emerging infectious disease, predominantly found in Africa, the Middle East, Asia, and southeastern Europe. Each year, over 1,000 cases are reported in these regions. In 2022, Iraq saw a surge in cases, and there have been sporadic reports from non-endemic areas like Spain. The disease peaks in summer months and is associated with the distribution of its main vector, the hyalomma tick. Transmission of CCHF primarily occurs through tick bites. Other routes include direct contact with the blood or bodily fluids of infected animals, nosocomial transmission, and rare cases of vertical transmission. Healthcare workers are at risk, especially during later stages of the disease with high viral loads. CCHF presents with a range of symptoms from mild to severe. Early symptoms include fever, headache, muscle aches, and nausea. As the disease progresses, it can lead to severe hemorrhagic manifestations such as bleeding gums, petechiae, and internal bleeding. Severe cases may result in shock, organ failure, and death, often due to a cytokine storm, causing vascular damage. Diagnosis is based on symptoms and risk factors such as recent travel to endemic areas or exposure to ticks. Diagnostic tools include RT-PCR for detecting viral RNA and serological tests for specific antibodies. Early and accurate diagnosis is crucial for effective management. Currently, there's no proven antiviral treatment for CCHF. Ribavirin has been studied, but lacks consistent clinical efficacy. Supportive care is essential, including managing fluids, electrolytes, and blood products as needed. Patients should be treated in specialized centers with isolation precautions to prevent disease spread. Preventing nosocomial transmission involves strict infection control measures. This includes using personal protective equipment, safe handling of sharps, and proper disinfection of contaminated areas. High-touch surfaces should be cleaned with effective disinfectants like sodium hypochlorite or alcohol. The mortality rate for CCHF varies widely from 2 to 80%, with higher rates in certain regions and nosocomial cases. Predictors of poor outcomes include severe hemorrhage, impaired consciousness, and high levels of CCHF RNA. Preventive measures include avoiding tick exposure by wearing protective clothing and using repellents. In endemic areas, controlling tick populations in livestock and practicing safe slaughtering methods are vital. Educating people about tick prevention and proper handling of animals can help reduce the risk of CCHF. To recap, CCHF is a serious viral illness with significant health implications. Understanding its transmission, clinical features, and preventive measures is crucial for managing and reducing its impact. For more information and updates, don't forget to subscribe and hit the notification bell. Thank you for watching. Stay safe and informed.